Good evening, everybody, and thank you very much for joining us this evening to discuss the Masters of Health Services Management offered by UTS Online. Before we get started, we'll just give a couple of people just a few more minutes to settle in. So grab a warm cup of coffee, sit back and relax, and hopefully we have a great session lined up for you. To everyone who has just logged on, thank you for joining us. We will be beginning this session in the next 2 minutes, just giving a few people the chance to obviously attend and settle in before we kick the information session away. Brilliant. Thank you very much, ladies and gentlemen, and welcome to today's information session on the Masters of Health Services Management. My name is Izad Iqbal. I am the Senior Program Lead for the University of Technology, Sydney. And today's session is obviously designed to give you a bit more awareness about the course and hear from our wonderful academics in regards to the program and answer any questions that you may have. Before we begin, I would like to acknowledge the Gadigal people of the Eora Nation, upon whose ancestral lands our city campus now stands. I pay my respects to elders past, present, and emerging, acknowledging them as the traditional custodians of knowledge for this land and as people of great ingenuity and innovation. In this webinar, as I've mentioned, we will be sitting down with our academic team to talk about the healthcare industry, skills employers are demanding at the moment, and how postgraduate studies can help you accelerate your career in health services management. Now let's first take a look at your webinar controls. You'll be able to see the chat function, your raise your hand function, and the Q&A functions at the bottom of your screen. If you do have any specific questions throughout the session, feel free to have your questions in the Q&A box. And once the session's over, we will be hopefully, we'll obviously go to each question in turn and have them answered for you. Now let's take a look at UTS Online, Australia's #1 young university. We are a university for all. And our flexible online programs, we want to give professionals an opportunity to upskill and earn a degree without sacrificing their jobs and other important commitments. We do offer students quite a range of resources and support, ensuring that you're well taken care of within your postgraduate journey here with us at UTS. A common perception of online studies is a series of uploaded lectures, recordings, and PDFs. Here at UTS Online, we have designed our courses from the ground up, specifically to be studied online and complementing the demands working professionals generally face. We'll share a link to a video that goes through our learning design process in the chat below. This will give you an idea or an insight to UTS Online, which you can view at your own leisure. Now, before we meet the wonderful academics, I'd like to introduce you to the Master of Health Services Management here at UTS. The Master of Health Services Management is one of the most contemporary, comprehensive courses of its kind. It's been developed in partnership with leading industry professionals to give you a clear insight into the complexities of the Australian health and social care systems and how to navigate its unique politics, policy, and data. The course is designed for professionals who are passionate about driving positive change in health and social care. Students will gain the capabilities and tools to effectively plan, evaluate, and lead change to create safer, more equitable systems and services. The course offers specific majors in quality and safety, leadership or planning, so that students can tailor their studies to their career interests. So students can also opt for a general option with no major, in which case a student enrollment advisor can help you construct an individual or a tailored study plan catering to your specific needs. It is delivered part-time and 100% online, completely self-paced, allowing students to continue working full-time while studying. The program consists of 12 subjects, and students focus on one subject at a time in 7-week blocks, allowing students to manage their work and life commitments while gaining the skills to advance in their careers. We're now going to hear more from the course director and academics about the roles of a health services manager, if you like, the skills in demand, and how the Master of Health Services Management can prepare you for a successful career in health and social care. Now, before we get into the topics and questions, let's meet our wonderful academic team, stars that make this all happen. I'd like to introduce you to Professor Joanne Travaglia, who is the Head of Health Services Management Program at UTS. Joe, welcome to today's session. Thank you so much for joining us. You lead the development of this course. Can you just give us a bit of an insight into what students will learn from the Masters of Health Services Management and how it prepares them to face some of the challenges that the industry faces today?
Well, the Masters of Health Services Management has been designed specifically for practitioners in health and social care. And the idea is that we prepare people for what's being called a VUCA world, which is volatile, uncertain, complex and ambiguous. And that was before the pandemic. So now it's even more so. So we're looking at the kind of competencies, knowledge, skills and attitudes that managers need to manage within that context. As you said, we have streams, specializations in leadership and quality and safety of care and in planning, which are all areas that have emerged out of the Royal Commissions as being particularly of importance. And so we really want to look at the students' capabilities, help them address the particular issues that will arise for them as managers and for their staff.
Fantastic. We have received a lot of positive feedback from students around the practicality of the course, I guess, Joe, and with some graduates noting that an assessment of learning tasks directly, helping them address the challenges in their own workplaces, for example,
yes,
or acquire a new job. How has the course, I guess, been designed to prepare students to succeed in the workforce?
It's been particularly heartening to us to get the number of emails that we get from our students unsolicited saying, you know, I did this in your subject and I was asked about it in a job interview, or I was asked about it by my manager, and I was able to develop a strategic plan or respond to a patient's concern or complaint, or you know, think about how we might go forward in terms of our workplace. So the assessments that we have are what we call authentic. So they're based on real life issues and organisational problems. So each practice run, each assessment a student does, gives them another set of skills. It's not just about testing them, it's about developing their skills and giving them the capabilities to undertake real life tasks that they will need as managers in health and social care.
That's very inspiring, Joe. Thanks for sharing that. It's always great to hear some success stories from our students. I personally have had students reach out to me with some fantastic feedback from the entire academic team who are here today as well. Now, shortly, we're going to meet the rest of our panel, obviously, and open the discussion around what healthcare leadership looks like today and in the future. But before we do so, I'd like to set the scene by uncovering what the role of a health services manager is, given some of the complexities around it. So, Joe, as a researcher, as an experienced professional in this field, I'd love to hear your take on this. You know, what is the role of a health services manager? What are the core responsibilities, and what are the skills that are needed to be successful in this role?
It's interesting because health services management is a field that's growing rapidly, and health, social care, and health and social care as well. And I think of it, the skills required and the competencies required as management plus, because managers in health and social care need all the same skills: planning, management of staff, management of resources that any manager needs. They're standard. But in health and social care, we have literally are dealing with life and death situations. So it's everything plus understanding the fact that the decisions you make as a manager has a direct impact on people's lives. And also, having said that, healthcare is very political. We're exposed, and so is social care, very much exposed to media scrutiny, to public scrutiny, to political scrutiny. So the kind of skills that people need as a health manager are all the process resource management skills, but also how do you communicate with the community at large? How do you communicate with politicians? How do you negotiate for the resources that you need? So it's a very complex set of skills. And underlying all of that, and something that's come to the fore with COVID, is the need for compassion and the need for integrity. And that's something that's come out very clearly all around the world. And we'll talk a little bit more about that later tonight.
That's fascinating, Joe. And as you were mentioning this, I was obviously just recalling some of the challenges we've seen in real life post-COVID-19 as well. So that's fantastic and really interesting to gain your insights there. Now, to do some of the academic team, I guess one of the reasons I feel, we have a very successful program is because of the academics who work alongside Joe. And first, it's my pleasure really to introduce Dr. Hamish Robertson. Hamish, again, thank you so much for being here with us today. Your research into aging population and rising multimorbidity has highlighted some of the key challenges facing our healthcare system. What role would health managers rather play in responding to Australia's aging population?
Well, I think it's fair to say that, in my opinion, managers and leaders will be key to the transition to successful population ageing at both a systemic and a societal level in Australia. We're really only part way towards the peak of population ageing here in Australia. It's not meant to peak until 2050, but the curve is steepening now. And I think one of the fundamentals that people are expressing to us on the course already is that population ageing is proving a challenge to existing models of care. So in a sense, we tend to move forwards looking backwards in healthcare, whereas one of the differences with this program is that we're acutely aware that population ageing has massive implications. And so looking outwards to what is coming up the highway in terms of what healthcare managers and social care managers will need as skill sets and a knowledge base to function effectively, are fundamental inclusions in the course. And so I think some of that's about the complexities. So for example, we know that health is not only important in healthcare, it's important in aged care, and it's important in disability care as well, for slightly different reasons, but nonetheless, there's this central crux around which the skills of managers and leaders are going to coalesce as population ageing progresses. And I think, as Joe alluded to too, recent events such as the COVID pandemic, even the floods up in northern New South Wales and Queensland, show that one of the fundamental skill sets for health and social care managers will be how to function in crisis events, because it's the most vulnerable people who will be at risk as the frequency and intensity of these types of events increases.
That's brilliant. You can obviously see some of the challenges, I guess, faced across the nation at the moment. It's really interesting to see the validity, I guess, in terms of how the program can really help leaders face these challenges. We also have up next Janelle Craig. Janelle, welcome again. Lovely evening to you. Could you please tell us which subjects you teach as part of the Master of Health Services Management program? What are you most excited to share with students based on your experience and expertise?
Thanks, Izzard, and welcome everybody. I teach 3 subjects into the Master of Health Services Management course, and that's Fundamentals of Health Information Management, Contemporary Approaches to Digital Health, and Using Healthcare Data for Decision Making. So all of those subjects have a real focus on data and information and digital technologies. And that's really important because there's an increasing recognition that both current and future managers and leaders really need a strong skills base in those domains. So for me, I'm really excited to be able to expose students to the really remarkable innovations that are happening in digitisation and how that's revolutionising health and social care. And I think importantly to be able to better enable graduates to be able to work in and contribute to so many of the developments that are happening in this digital environment. So yeah, exciting times.
It certainly is, Janelle. It's an exciting time, I guess, in the healthcare industry, and picking up these skills within your area of speciality will obviously benefit a lot of students at the moment. So thanks for sharing that with me. Last but not least, Dr. Suyin Ho. Suyin, we would love to hear a bit more about your research on video reflexive ethnography and the impact it's had on healthcare delivery, I guess. How does the innovation and technology like VRE contribute to improved healthcare outcomes?
Well, My research work has really always been about collaborating with healthcare workers and patients to examine what actually happens in day-to-day healthcare delivery and to make sense of it with them using video, right? So that's where the video comes in. And my particular focus is patient safety. So things like how people communicate with one another to create safe care, how they talk to each other when something like an incident has happened, you know, how they discuss it, make sense of it, write the report, manage the report, how they manage interruptions in the busy ICU and things like that. And in the last decade, I've been looking at how complicated and complex infection prevention control actually is in the hospital, obviously very current now, but then not only in the hospital, but also in the community, like, you know, with GPs and ambulance practice. So I think what I really like about, you know, the research and the teaching is that I can draw my research and also the research that's really cutting edge of the team, you know, that we have here to really give life to our subjects. So I teach safety and quality improvement, as well as improvement methods and innovation. And so when students are taking these subjects, what I can do is teach them not just about, you know, frameworks and theories, but we can bring in a real sense of what doing safety and quality improvement really means in practice. And you know, we talk a lot about how messy and complicated it is. And, you know, a lot of students who work in healthcare already know this, but we help them to navigate that, right? I wanted, if it's possible, I can share the quote from the latest student feedback that we got in February, I think. And I really like this one. So the student said, you know, I came in thinking that quality and safety sounded boring, but it was actually so exciting. I thought that was just the funniest comment.
Absolutely, Dr. Suri. Just hearing you speak about it with the energy and passion that you bring makes me get excited about quality and safety. So it's fantastic. It's brilliant to share. Now let's dive into the industry academics. You know, I think according to Job Outlook, the industry is expected to grow quite steadily. I believe 80%. Yeah, 80% to reach 36,200 jobs by 2025. I'm going to throw this one to the panel, I guess. Is Australia's aging population a reason behind the increasing demand for health and social care managers? If not, what do you think are the main drivers of growth here? And I believe some of this will echo some of the thoughts that Dr. Hamish had previously as well.
First of all, let me explain to people why Dr. Robertson and I are swapping in and out. Unfortunately, my computer failed just before this session, so I'm in his room and we're having to play swapsies, so do forgive me for that. That's why. Look, our team, and I don't want to speak for our team, but I will, we're a bit resistant to the argument that, you know, everything comes down to an ageing population. Of course, as Hamish said, and the population is aging and increasingly so, and that is a factor in terms of demands. But also are issues like comorbidity and a whole lot of the issues that have been identified in the Royal Commission in Aged Care and the Royal Commission of Disability Services as well. There's quite a large amount of evidence about shortfalls in the quality and safety of care, and for vulnerable groups and individuals in particular. So we take all of those issues very seriously in our course, and as Suyin said, in a way that is also engaging. So it's not all hard work and it's not all doom and gloom, but it is important. One of our colleagues, Dr. Deborah DeBono, who can't be here tonight because she's actually teaching, also wanted to make the point that the Royal Commissions have made explicit the public role of leadership and governance in the delivery of safe, high quality care. So more than ever before, issues of management and leadership have come to the fore. And so there's a number of reforms that they've put into place that will reshape health and social care and aged care and disability services that will demand more leaders and managers who can look across the organisation and can take people with them in terms of delivery of high quality, safe care, irrespective of what type of organisation it is. And we have students, just to reinforce, from primary care and community health and the private healthcare sector, optometrists, physiotherapists, as well as people who work in hospitals. So our program covers all of those issues, not just hospital-based care. And all of those areas require more leaders and more managers.
Fantastic, Joanne. Thank you very much. Dr. Robertson, would you like to give us your take on it as well, please? Thank you.
So much for technology in this instance. My take would be, I'd say that we already face a serious and growing workforce challenge across health, aged and disability care services. There were issues there before COVID, but I think a lot of the people that we see on our program at the moment are tired, and there's feedback from the sectors that many of the individuals in the workforce are rethinking, if you like, their personal priorities, but also their workforce priorities. So that creates opportunities at one level and challenges at another. I suspect, and my own take of this based on the experience from students is, it puts pressure on people to be able to perform. There's an expectation that skill sets will grow and that people's domain capabilities will expand. And that's essentially a kind of demand factor. And another aspect of that, I guess, is that we will need to be consciously aware that managers and leaders will need the skills to operate functionally in that space so that they have the capacity to manage a workforce which is under pressure, to maintain continuity of workforce and skill sets. So there's a number of issues there which, you know, when you look beyond, say, for example, aged care as a driver, we have other issues such as not just the demography, but the complex nature of epidemiology across Australia, systemic changes in policy and funding. You know, the budget's just come out yesterday. So we're seeing continuing changes which represent challenges to managers and leaders' knowledge, skills and capabilities across health, aged and social care more broadly.
Fascinating, Dr. Robertson. It certainly is an interesting time, I guess, to be in the healthcare sort of setting. Janelle, what about yourself? Would you like to add into any of the comments made so far?
Yeah, look, I think there's been a really good summary so far. So just adding briefly, I think the focus on cost containment and funding is certainly a real catalyst in health and social care, and it shouldn't be sort of that surprising to people that I would say also to digitisation and just the impact that technology is having on modes of care, models of care, delivery modalities, and the implications that's having for the workforce and particularly leaders and managers.
Yeah, that's really interesting, Janelle. Thank you very much. And I'll throw it to you, Dr. Suyid. What about yourself?
It's interesting because reflecting on everything everyone has already said, I remembered a couple of years ago, I was speaking to a really well-liked and well-respected nurse manager in a hospital in a ward. And he told me, you know, most of his job was actually about managing change, right? There's always new regulations, new funding, new structures, new staffing, new technology, like Janelle was saying, all the things everyone's already mentioned. And you know, the thing is, what makes a difference between a good manager and, you know, one that's less successful is that they're able to make a real difference for their staff amidst all the constant change. And we really do need more good managers.
Yeah, that's really interesting. Thank you, Dr. Suyid. And I guess I'll speak on behalf of, you know, some of the students I've spoken to in the past few months, and this question keeps coming up over and over again. So I would love to gain your insights on this here. So health and social care managers can obviously work across diverse range of environments. I think that's what we've established so far, you know, such as hospitals, health practices, government agencies, just to name a few. So what types of positions can graduates pursue now and in the future? And also for those perhaps looking to restructure their careers as well. Would you be able to sort of give us a bit of an insight there?
Sure. Well, we typically have students from two groups. So we have people who are looking to become managers within their organisation. So they want to upskill so they can apply for a management leadership job in their own organisation. So that's moving up through wherever they are. But we also have a second group, which is people who want to get into health or social care management or want to transfer from one to the other. So in recent years, we've had quite a number of people who have been in healthcare, but who want to move to aged care or disability services. So the course can help people doing all of those things. I mean, in terms of either progressing within your own organisation and taking, for example, going from a nurse to a nurse unit manager, or going from aged care to healthcare or healthcare to aged care. It gives you the insights that you can think about in terms of crossing sectors. And also all the, the job titles that we have on the slide that are in demand, clinical services manager, primary healthcare manager, all those basic skills and capabilities that are required, we cover as a baseline.
That's fantastic, Jo. It's really interesting to obviously gain your insights here. And I guess, the healthcare industry has been one of the most stable industries across Australia for a larger period of time. Obviously, it makes a lot of sense. Dr. Robertson, would love to hear your thoughts on this as well from your point of view.
Yeah, I think this connects quite well to your previous question too. So to follow on from what Jo said, one of the things we find is that we have quite an eclectic mix of students taking this program, and all of them are finding something in it which feeds into either their current work environment or the choices they're starting to think about in terms of their next steps in their career pathway. So I think one of the things we do tend to see is if people have a good foundation, say in some form of clinical or professional practice, and then they add a broad set of key management skills to that skill set, then they're well prepared for a wide range of environments, which you alluded to earlier in introducing this. And that makes them much more flexible and portable across a system which is undergoing a lot of change, is facing quite a few challenges, and is likely to remain quite fluid for the next at least 5, possibly 10 years in terms of current arrangements, because there's simply so much change, as was alluded to earlier. And that's making for, I think, some quite dynamic opportunities for people. So some of our students who are highly skilled are relocating to get into, say, exec level roles, where once upon a time they were in middle management roles. Those sorts of things present themselves through the program, but also people come to this program having made that decision that that's the kind of pathway they wish to develop for themselves.
Interesting, Dr. Robertson. Thank you very much for sharing your insights with us. And Janelle, what about yourself?
Well, look, I think Jo and Hamish have covered that really well. But certainly I share their excitement to think that there are just so many opportunities for graduates. Having completed the course, there are a wealth of different roles that they can move into, as well as having this new skills base to do an existing job in a different capacity. So great opportunities.
Excellent, Janelle. Can I also just add really quickly, from a technology standpoint, are there specific roles within health services management that are coming up with the industry as well?
I think that more and more as technology starts to embed into management and leadership roles, there'll be newly sort of developing roles that'll come about. And we certainly we've seen that just recently. We did a leadership seminar that the centre ran, and one of our guest speakers was the first ever appointed Chief Nursing and Midwifery Informatics Officer.
Wow.
And that was the first, with 2015, first one that's come about. There's been some more roles like that, specific informatics roles in allied health and in mental health, in those senior leadership. So it's great to see that there are these opportunities, opening up.
Fascinating, Janelle. Thank you very much for sharing that with us. And Dr. Suyin, over to you. What are your thoughts?
Not sure I can add, but Janelle, with that webinar as well that we hosted, I remember they were also saying, come and look at our website because we've got careers opening up, like we've got jobs, So it's obviously a growing area, like Isaac was saying. I don't think I have anything to add, but except that we often hear from our students, say, oh, just let you know that I've got a new position as the director of education at this facility, and you see them on LinkedIn as well, telling you about their new position. So it's really heartening. I love that engagement that we have with our students.
I do too, Suyin, all the way from applying to the end of their graduation. It's nice to see that connectivity there. So it's brilliant to hear that. And thanks for sharing. I've also done a bit of research, obviously, before entering this session. And according to Labour Insights, generally speaking, interpersonal and organizational skills are the most highly requested skills for health management roles, right? Why do you think this is the case, and how will this course help equip students with such skills? Over to you, Dr. Joanne.
Yeah, I think it's really interesting. I think people have always known that management, particularly in health and social care, requires both what people call hard skills and soft skills. And the hard skills are often things like financial management, resource management, strategic planning. The soft skills are about how we manage human beings, how we take care of our staff. And given that staff retention is one of the biggest issues in both health and social care, keeping your staff is a major skill for people, for managers. And a few weeks ago, we had one of our associate professors, Dr. Dominic Morgan, give a seminar, and Dominic is the CEO of the New South Wales Ambulance Service. And what he said was really interesting. He said in all his years as a paramedic, which is his whole professional career, he has never seen people as scared as people were in when COVID hit. And he said that paramedics were not frightened for themselves. They know how to manage themselves, but they were frightened in terms of thinking that they could bring COVID home to their families, particularly in the beginning of the pandemic. So those kind of skills, how do you as a CEO and a manager deal with people's very justifiable anxiety in a time of a pandemic that nobody knows actually how it's going to roll out, how it's going to play? So those skills, the interpersonal skills, are every bit as important as how do I make sure the budget is balanced this year? How do I plan for services? All of those things are very important as well. But taking care of your people is absolutely equally important. And so we spend a lot of time thinking about vulnerable individuals and groups, both patients and also staff in our program. How do we manage them? How do we take care of them? How do we deal with service issues that arise both during times of pandemic and outside of times of pandemic? What the pandemic has done is just bring things to the fore that were already there.
Fascinating, Doctor, and I completely agree. I think it's been a challenging few years for a lot of healthcare workers at the moment. And obviously speaking to a lot of students every day across the country, this is something that has constantly come up. So to show that obviously the course does equip them to work with their workforce really does help leaders in healthcare today. So thanks for sharing that with me. Over to you, Dr. Robertson. Love to hear your thoughts on this as well.
There's not a lot more I can add to what's already been said, but I think it comes back to the fact that these are fundamental skills for managers in this day and age. As Joe said, I think that the pandemic has essentially reinforced the importance of those skills, the communication with staff, but also with patients, that managers are pivotal in making effective, are key skills going now and going forwards. And I think also, if we can think of it in relational terms, we know there's a lot of technology in healthcare, but often what you're really dealing with is people under stress in environments that themselves have a tendency to increase that stress because they're not necessarily in acute care environments that supportive. And there's a lot going on. So I think the capacity to communicate, especially effectively, and we cover some of these topics. So we deal with some of the difficult issues, such as bullying in the workplace. We don't shy away from those. And we also look at some of the ideas that are out there in the environment for managing more effectively. So, for example, concepts such as emotional intelligence, or looking at how current neuroscience research is adding to our knowledge about leadership and management skills.
Fascinating, Dr. Robertson. Thank you very much. And over to you, Janelle. What would you like to add there?
Thank you. I think I agree with Joe and Hamish's sentiments that health and social care really is a highly humanistic area. And even in the technology-focused subjects that I teach, it's really important to bear this in mind and to think about the impact of technology in human terms. So things about organisational culture and workforce implications, things about ethical dilemmas, and there's certainly lots of those in technology, as well as equity and access concerns. So they're important to keep in mind. And we try and do that by taking a perspective that looks at a socio-technical approach. So this blend of sociology and humanistic approaches and technical and scientific advances. And sort of doing that by locating technology as part of a larger and broader health ecosystem. So looking at, inputs and processes and the complexity there. And that's a really useful approach because it encourages students to then consider and build skills in the human aspects of technology, not just about the techo stuff, but about the human aspects. And so then how its design and implementation and use is affected by those aspects.
Fascinating, Dr. Janelle. Thank you very much for sharing that with me. And over to you, Suyin. Well, do you have any thoughts on this as well?
Well, I guess I can speak to it from a safety and quality focus. So, when things go wrong in healthcare, it impacts really heavily on everyone. It doesn't have to go very wrong, to have people really stressed about what they should do, how they should talk about it, whether they should speak up. And this is not just, patients and carers, but also, the clinicians themselves. And so, in our subject, we look at communication around these fraud events, and we really work through practice, and we have assessments around what it means to communicate with compassion and care and respect. And we also talk about how, managers can actually facilitate healing after harm has occurred. So you can imagine really, really, really tricky situations and situations that managers are placed in every day, right? And so it's a really necessary skill that we need to get better at, basically. Yeah.
Yeah, that's brilliant. And it's really interesting to hear your thoughts from a quality and safety perspective. So that's spot on. Thank you for sharing that with myself. Moving on, thank you for sharing all that insight. I think, the audience obviously have really appreciated it. But now that we have an understanding, I guess, of the current industry, I'd like to also spend some time in discussing the future and what's ahead in what has been quite challenging times. So my next question for the panel is, what does the future of health and social care look like in Australia? What are the biggest challenges that we're going to be facing and the opportunities facing the healthcare leaders of tomorrow? I'll start with you, Dr. Joanne.
Well, without beating the pandemic drum endlessly, one of the things that the pandemic has done both in Australia and internationally is show the underlying fissures in health and social care, and particularly the way in which vulnerable groups and individuals such as the elderly and people with disabilities, who are going to make up more and more of our patient groups, have not been dealt with appropriately in many instances. So basically, I think in the future, what's going to happen is we're going to have to look at the social dimensions of care. And by that, I don't mean social care. I mean how we interrelate with people in the same way that Suyin was just saying, with compassion, with respect. And as Suyin said at the beginning, a lot of what healthcare is about managing culture and managing change. So yes, it's about managing people, but it's also about how do you set up an environment where everybody's oriented to the same perspective. One of my favorite stories is the one of John F. Kennedy going to NASA and walking around, and it may or may not be true. There's debate as to whether it's true, but the story goes that he's walking around NASA and he sees someone who's sweeping the floor and he says, "What are you doing?" And the guy says, "I'm sweeping." And it goes a little bit further, sees another person who's also sweeping, and he says to that person, "What are you doing?" And he said, "I'm keeping NASA clean." And then he goes to the third person who's doing the same job, and the third person says, "I'm sending a man to the moon." And that's essentially, for me, has to be the future of healthcare and social care, where everybody, doesn't matter what role they have, doesn't matter what tasks they're given, their aim is to provide the safest, highest quality care for the people that are entrusted to us that is possible. And that involves culture and change and resource management and all the other underlying management tasks that you need. But the biggest thing in terms of leadership is having the vision and being able to sell the vision to everybody who's involved.
Love it, Dr. Joanne. Thank you very much, and that's fascinating to obviously hear your thoughts there. I'll throw it back to you, Dr. Robertson. What are your thoughts?
Well, I think the future of health and social care is huge. As an aging researcher and obviously I think the population aging is a major driver in this space, but it's not the only thing that matters. And so I think we have quite a complex level of rising sophisticated issues across health and social care that will mean that the opportunities for people out there are growing and diversifying. And I think the diversification has already been flagged by Su-Yin and Janelle. But my own take from an aged care perspective is, yes, this will simply continue to grow. The demand for people who have niche skill sets that are managerial and leadership oriented, but perhaps are adjusted for emerging areas of need, will only continue to expand. And I think one of the key issues we need to think about is, while we keep talking about older people driving the need for care, around half the population now has some form of long-term chronic health condition. So that's, right there we have a driver for how we're going to manage this more effectively, how we're going to manage things like cost containment, the concept of value, which is increasingly embedded in our teaching, because ultimately costs continue to rise with new technology, we have more people. Where's the value equation in that? Is it providing value to employees? Is it providing value to patients and communities? So those are the kind of factors, I think, which will expand people's opportunities across this broad sector. And as I flagged a little earlier, I think the fact that we're seeing more frequent and more severe environmental and related crisis events will also mean that the kind of skill sets people need to have to function well during those types of events will also expand the demand for skilled people. So, we deal with the ambulance service, which Joe alluded to, but we're seeing, I think, that those types of emergency response skills during crisis events will only grow as part of the leadership and management skill set.
Brilliant. That's a very interesting take from you, Dr. Robertson. Obviously, it's quite challenging, I guess, being a modern day healthcare leader, and it's really nice to obviously hear your thoughts there. And speaking of our in-house technologist, Janelle, what are your thoughts here?
Well, I'll sound like a broken record here. This won't sound to be very much of a surprise, but I think in the last decade or so that the way that we engage with health and social services has changed dramatically. And my take is really related to digitisation and technology. And I think the increased reach and impact of digitisation has just been had such a big impact on so many aspects of health and social care. So, you can think about that and you can actually see that. And I'm sure there's lots of participants today who are engaging and would be nodding your head here when we look at, we're doing consultations via telemedicine, there's wearable devices, robotic surgery, access to electronic health records, and My Health Record is a good example of that. You go into clinics now and children are wearing, virtual headsets to help them cope with experiences in hospital and getting needles, for example. And hospital in the home technologies are happening more and more. So really great opportunities, I think, to improve clinical outcomes and address current healthcare challenges. But the introduction of technology also carries with it risks as well. So I think anybody working in health and social care, as Hamish said, needs to have a really strong and broad skill set. And I think for managers and leaders in particular, they need a really robust understanding of both the benefits and the risks that new technologies and digital health can bring into their practice. So a real balanced approach, but certainly it's a big issue on the is there a driving change for sure.
Absolutely, Janelle. Couldn't have worded that better, and obviously really appreciate your insights there. Over to you, Suyin. What are your thoughts here?
Trying to think what to add to this. I mean, I guess, again, from a safety and quality perspective, all the things that have been mentioned impact on safety and quality, all the new technologies, changing demographics. I guess one thing that so safety quality field is actually quite new. It's only about 2 decades old. And a lot of it has come from other industries, and healthcare has been borrowing, frameworks, idea systems, ways of doing investigations. And I think over this time, we're learning a lot more about what safety in healthcare means as opposed to safety in other industries. And so I think the attention now seems to be shifting towards understanding what a safe workplace is for patients and staff. What actually happens to create safety, not just why things go wrong. I mean, there's still a lot of work to be done there, but it's a lot about how people talk to one another. I think I said this before, talk to one another to understand how their work happens, and not just, within the silos of this ward or this team, but across boundaries, and very importantly, including patients and their families and their caregivers, right? So those things are, I think, going to drive this area in the coming years. And also, I'm going to repeat what everyone else has already said. We have an exhausted, burnt out healthcare workforce, right? Very much in need of compassionate leadership. So that is got to be a top priority now as well.
Absolutely, sir. And that's a fair point. And really do appreciate your thoughts there. We've raised some really great points for discussion here, and a big shout out to the audience as well, who've been enjoying some of the content we've been discussing here, and feel free to slip in any questions down in the Q&A box, which we'll answer shortly. Clearly, from what I've gathered, things are changing fairly quickly, right? And clearly there's still a lot of work to do to improve our health and social care systems, which poses great opportunities and challenges for future leaders in this space, as we've already highlighted. That leads me to my final question for the panel. How does the Master of Health Services Management program prepare students to tackle some of these challenges as discussed? I guess a short summary of every bit and bob that we've just discussed here.
In lots of ways, it flows on exactly from what Suyin just said, which is basically what we do is provide them with a safe space in which they can develop the knowledge, skills, and attitudes required to tackle these problems, and a safe space in which to practice. So more than anything else, we give them an environment where we try and model what it looks like to allow people to innovate, to think about things in a different way, to think critically about their organization, about their practice, about what's happening, to be really develop the reflective skills. So going back to almost one of your first questions, which is about the soft skills of management. What we try and do is, yes, absolutely give people the hard skills they need, but also give them the safe space to practice innovation, to think about things, to question, to come up with new ideas in terms of what the organization is doing, what the sector is doing. And I think that's exactly what we need, and that's exactly what the pandemic has shown us and has brought into sharp relief, that the strategies and approaches of the past are not what we need for the future.
Love that, Dr. Joanne. Couldn't have said it any better. And over to you, Dr. Robinson. What are your thoughts here?
I have a few thoughts on this point, and I guess some of this comes back to what the students have been telling us so far. So, for example, in my first teaching subject this year, I had a student say, I really like the fact that this program is focused 3 to 5 years out from now. And I said, that's absolutely right. I said, we have to provide a certain amount of material that tells you how we got to where we are currently, because that's the foundation of the system within which you're working. But as health managers and potential leaders across health and social care more broadly, we also have to flag what's coming up the highway. So, for example, Janelle mentioned digitization's growing influence on the system within which we work. And so it's that future focus, I think, which informs a lot of what we're currently providing students, and which many of them have articulated as being a key benefit, if you like, of the program. And from my own perspective as a teacher on the program, I'd also say that we are acutely aware of the feedback that students provide. So for example, if they're working through the material and they're posting their understanding and analysis of the material that's provided to them, then we're obviously reading those responses and feeding back to them on the basis of that. And that's one of the rewards of the process, I guess. Not only do you see how people are actually analysing and thinking about and benefiting from what's being provided, but how they're integrating that into their own mindset and how they're likely to apply it going forwards in terms of getting into those management roles or skilling up within the current roles that they already have. So I think it's almost like an ongoing feedback with this particular program, because we're constantly hearing from students what's good, what might be a bit mediocre or less use, but also what they're encountering in their workplaces. And so that keeps it very, very live. It's not just, material that people work through. And I think my final comment there, and I'm probably over talking, but nonetheless, the final comment is, Joe mentioned the point about our assessment process. And I've said to students, even just this year, we're not marking to a curve. This isn't an examination type approach. What they are is opportunities for you to gain experience practicing the material which we've discussed in class, that we've worked through in terms of your readings or the video material or the other resources provided. That it's about your professional development. And the purpose of this program is to enhance your own professional development and your own career pathway.
Fantastic, Dr. Robertson. I think speaking to a lot of students and obviously talking about the course quite regularly, one thing I do appreciate is the practicality of the skills students do get out of this, preparing them for the challenges ahead. And it truly is a program for the future, that's for sure. So thank you very much. Over to you, Janelle. What are your closing thoughts?
Well, I think Joe and Hamish have encapsulated that really well. Things about, I think the course there's been lots of thought put into the development of the course and to each individual subject and how they tie together as a suite of subjects and the interrelatedness. I think we work hard to make sure that students are making connections between the subjects. I think that's really important. But as has been said, lots of thought into things about critical analysis, collaborative practice, problem solving and decision making. And as Hamish just said, I was actually teaching last night into that subject. I do contemporary approaches to digital health, and we're on to our second assessment task. And a couple of students said, "Oh wow, we're really excited to do this assessment task." Now that is a rare comment, a rare sentiment. Most people think, "Oh, it's another thing to do," but to say, to have somebody say we're really interested in this, and that was driven by the fact that it's really practical, and students can see a connection in doing the task, but it is real life, and they're taking it back and using it in the workplace. So comments like that are, tell us, as Hamish and Joe said, that we're on the right track. And I suppose the last point I wanted to add, and I think this is a real selling point of the program, is that it's one of the few master's programs that actually includes subjects specifically designed around data and information management and digital practice. And I think that's a big selling feature because it enhances graduates' ability to function as leaders and managers in a digital age. So I think that's a great thing.
I couldn't agree more with you, Janelle, and thanks for highlighting that. I guess the focus on big data used to make more precise decisions is a massive selling point for modern day leaders. I couldn't agree more with you, and it's a brilliant point there. And over to you, Suyin, from a quality and safety perspective, what are your thoughts?
What I would like to add is that, I agree completely with Hamish that, I like the way he phrased it. Our subjects are living. They're not kind of, fixed and then go. We're constantly updating them. Even as we're running the subjects, so there's always some flexibility. We're always listening to what students are telling us from their own experiences, and then using those to help them guide them through those problems. But the other thing is also that this team, I think, has our fingers on the pulse of what's happening because of our research and service. So we are all, doing various things that allow us to really get a sense of what's happening in the world, what's happening in industry. That's really important. and constantly feeding that into the subjects as well. So I think that's another benefit.
Yeah, absolutely. Really, really interesting point of view there from you, Dr. Soin. And thank you very much. I'm just mindful of time, and I really want to try and get around some of the questions that our wonderful audience have put forward. I've got some really good questions that have come there. So thank you very much again. We now open the floor to questions. Let's kick them off with some FAQs and begin answering some of the questions through the Q&A box. So just bear with me while I bring this up for you really quickly. So a student has gone on to ask, I have a Bachelor's of Health Services Management, currently working as a project officer, working in a disability sector. Is this course suitable for me?
Yes, I would say even with the Bachelor of Health Services Management, our course is a postgraduate course, so it would extend what you've done at an undergraduate level. I mean, again, as we said, our specializations, so you may not want to take just the generic masters. You may want to say, okay, quality and safety is the area I want to go into, or planning is an area, or leadership, which is again quite popular and broadly applicable pretty much to any organisation you go to. So yes, if you think about it as extending the skills that you already have, it would definitely be useful.
Thank you, Dr. Joanne. And just building on that, a student has also gone on to ask, I'd like to expand skills in project management and to manage an organization. Which major can help me reach these goals? I guess just echoes some of the thoughts that you've just shared there with us.
We don't have a specialisation in project management, although it is an area that we are interested in, and in the future we're hoping to have more subjects around that area. At the moment, we don't have a specialisation in project management, but you will, for example, in organisations, a lot of our subjects like organisational development, like managing quality, risk and costs, there are elements of thinking about projects and how you might manage them.
Fantastic. Thank you, Dr. Joanne. A student has also gone on to ask, as a clinician working in a hospital, I am interested in upskilling and trialing with stepping into more management roles. Unfortunately, I do hear a lot of senior clinicians speak about how much politics there are in management. How is all about budgeting and cost cutting, etc. So I guess that they're just seeking your guidance here on stepping into management positions as a clinician.
I think, and I might hand over to Dr. Robertson as well. I mean, a lot of our subjects like managing quality and risk and costs is exactly about that. It's about how do you balance those elements? How do you balance the books, the money? How do you balance the quality of care? How do you think about, you know, the safety of your patients? Many years ago, someone said to me, who was an emergency department doctor, and she came to do the Master of Health Services Management exactly for this reason. And she said, I've come over to the dark side. You know, management is the dark side. You know, there's clinicians on this side and management on the other side. And at the end of the course, what she learned was how to speak the same language. You don't have to agree, you don't have to support budget cuts, you don't have to agree with the politics. But if you have a good understanding of where the politics comes from, if you have a good understanding of the language that people are using, you can negotiate, rebut, manage that process much more effectively. At least that's in my experience of having taught health services management for 20 odd years now.
Fantastic. Thank you, Dr. Joanne. And yes, Dr. Robertson.
Yeah, I was just going to add to that, yes, of course, healthcare is absolutely riddled with politics at whatever level you're at. So, you know, clinical practice has politics, management obviously has politics in any health-aged or disability service provider. But I mean, that's a foundational aspect of what you will need to know if you're going to progress. So if your intention is, and a lot of our students find, they look back, they used to be clinicians and all of a sudden they've become managers. And then they go, oh, You know, I used to be a clinician, but now I've got a whole team of people, and I'm liaising with other parts of the organisation, and I'm having to deal with budgets, and I'm having to deal with rosters, and you know, this essentially has become my role. So as Joe said, I think one of the things there is, you know, you've got a couple of choices. You can try and avoid that, and some people do. They go into private practice or whatever. Or the other thing is you learn how it works. And so you're better prepared for that. And we've had at least two mid-career doctors on the program over the past 12 months who have both said that effectively taking the program is helping them do their jobs better. So, you know, we can only go on the endorsement that we get in terms of feedback from students as to how effective the content feeds into their capacity to manage those sorts of issues within their organisations. But that's the kind of feedback we are getting from people. So we'd say, yeah, absolutely, you're quite correct. Politics is foundational, and it's in our program because you have to know how to deal with it.
Thank you very much, Dr. Robertson. I actually do love the fact that we were so adaptable, I guess, in terms of coming up with such a comprehensive syllabus catering to the specific side of things. I've got another really interesting question here. A student has gone on to ask, I am a physiotherapist, but have taken a career break and have decided to move into health services manager roles. Will this course and associated assignments be able to be completed effectively if I'm not currently working?
Yes.
Yeah.
Sorry, yes, we're all nodding. The answer is yes. You don't have to currently be working. You have to have some understanding of the field, and having been in practice gives you that understanding, but you don't have to be working at this time.
Thank you, Dr. Joy.
And I'd say, again, in terms of people who have an allied health background, we've already had feedback from students who have progressed into either managerial placement roles within their organisation or who have gotten new jobs as a consequence. And that includes physiotherapists. I had one last year. She'd done the strategic planning assignment in organisational management, and she said, oh, I had an interview booked for this job. And she said, I went along to the interview, you know, while she was doing the subject, and the topic of strategic planning came up in the interview, and she was able to basically respond appropriately in that moment, and she got the job.
Oh, wow. Big win. That's fantastic. That's really good to hear. I've got a really interesting one that has just come up here in the Q&A box as well. So the student says that she currently works as a naturopath and also does a bit of research. And basically her current role has asked if the program that we offer covers anything along the lines of health economics.
We're just at the moment, we don't have a health economics subject, but we will have in the near future. It's in development. With the Centre for Health Economics Research and Evaluation. So also a UTS research centre, which is renowned for health economics, and they're developing the subject for us, and it will be part of our course offerings.
Fantastic, and we will obviously keep you we'll keep you updated on any changes and when the program when the subject is rather integrated into the syllabus. A student has also gone on to ask, and I'm not too sure who would be the best one to answer this, but what would be the skill sets I would get from, say, undertaking the Master of Health Services Management with UTS as opposed to the MBA with a healthcare specialization?
Thank you. It's lovely that's a wonderful question. And I can say this honestly, absolutely, as I've taught in these subjects for 20 years. And the number of times in a number of universities where people have come to health services management having enrolled in an MBA. And MBA is fabulous and it's generic, but what you get taught in an MBA is not the same as what you need in terms of managing in healthcare. It's a different situation. So people will come to us often and do their electives from an MBA with us because they say, as in the case of the person before, I'm a physiotherapist, and what I'm finding is the MBA is great for spreadsheets, but when they say, you know, you can manage your staff this way, and I look at them and say, you can't manage doctors that way. We know you can't manage doctors that way. That's the reality. the context is different, the politics is different, the environment is different, and that's what they will get from our holistic course in the way that Suyan and Janelle and Hamish have been talking about as well, that they won't get just doing a couple of subjects in an MBA. It really is, our course is designed to work so that each subject reinforces the next one and you build a very broad base of knowledge.
That's a fantastic answer, Dr. Joanne. Thank you very much for sharing. Just a few more. I'll just try and get this out of the way really quickly. So student, it's just as you've been answering that just mentioned. Hi, I've been practicing as an OT for 6 years. Is this course good for just building general leadership skills, or is there another course more suited for this?
This course is certainly good for general leadership skills. And I think that's one of Joe's areas of specialisation, is leadership practice across the health, aged and disability care sectors. Absolutely. So we've had a number of OTs come through the program already, and certainly one of them out at Westmead said that she got a temporary management role end of last year, I think it was, as a consequence of doing the program. So one of the things I guess we can emphasise is, and this isn't just some sort of sales pitch, the feedback that we've been getting over the last 2 years is that people actually get positions thereafter as a consequence of participating in this program. And as Joe said, you know, that doesn't negate doing, say, an MBA or some other qualification further down the track, or vice versa, doing something like that that might be a broad business type program and then coming to managing health services management. So I think they're complementary as programs, you know, and many allied health professionals are on our programs now and finding it useful.
Fantastic. Thank you, Dr. Robertson. Dr. Joe, I've just got a question just building on the previous one that was just asked. A student has asked me the flip now and said, if, for example, I do not work in healthcare, but say I do the MBA, would I be able to cope with undertaking healthcare specializations, providing I've not had any experience in healthcare at all?
It's hard. It's difficult, and it's not just our course, any course that's specifically health services management. It's possible, but it is very hard if you don't have any knowledge of health or social care. It doesn't have to be healthcare. If you've got knowledge of aged care or disability services, that is often enough to give you the context that you need. But having no experience it can be quite difficult. And it depends, you know, the situation is, it depends on how much you definitely want to get into the field. I had a student a few years ago who had no experience. He was an accountant, but he really wanted to get into healthcare. So he volunteered.
Fantastic.
And he got experience in hospitals by volunteering. So that exposure was enough to give him a sense of what are the issues, who are the people, you know, what are the patient concerns about. So yeah, there are ways around that.
And I would add to that, we came across this question earlier in terms of when we were talking about the variety of roles that are available to people. So if you have a skill set such as, say, financial skills, and you add something like an MHSM to that suite of skills, that will make you a lot more marketable to organisations, say, for example, not-for-profits working in the healthcare space, or smaller aged care providers, or disability service providers, you know, that provide, say, entry to middle level positions, because often they will upskill you going through. So you'll get that knowledge in that role that then you can parlay into, you know, further progression throughout the system. And I guess, you know, never forget that there's significant workforce churn across health and aged care. Therefore, they are essentially always looking for people who are willing to undertake new job roles.
That's a fantastic point of view, Dr. Robertson, and thank you very much for sharing. I've got time for one final question, and Dr. Suyan, this one's for you. All right. A student has asked me, currently I work as a project officer for 1.5 years now. I implement training programs for clients with neurodiverse disabilities, mentoring, and also provide direct project support to senior management team and board members. I also saw the course for quality and safety major is this suitable for someone like myself? I'd like to grow into my career into a health manager. I'd love to hear your thoughts.
Look, I think I would say that I see no reason why not. It really depends on what kind of health manager you want to work as and where, that kind of thing. Safety and quality it's something that is pretty essential to any aspect of health and social care. So whatever, if you do this course, it's going to be absolutely applicable, even in your current, work implementing these programs. Yeah. I hope that answers your question. I think so. Yes, basically, but it does depend on what kind of health manager you want to be.
Absolutely. And sorry, I know I said that this is going to be the last one because I think it's a very valid question that comes up over and over again. A student has gone on to ask, is this course accredited by the Australian College for Health Services Management and the Royal Australian College for Medical Administrators? I think, Dr. Joanne, I'd like to pass this one to you.
Yeah. It is at the moment accredited with the Royal Australian College of Medical Administrators. Because we change our structure, we're in the process of being re-accredited by the Australasian College of Health Services Management. And I see I'm 100% sure that we will get that accreditation in the next year.
Fantastic. This is brilliant. Look, I know we've gone over time, and I just wanted to say thank you to our academic team. Thank you for taking time off your busy schedules to be here with us and the audience. I'm sure you've appreciated it. And to every single person who's taken time off their Wednesday evenings to attend this session, truly hope that you found this session quite useful. And on behalf of the academics, on behalf of everyone at UTS, we'd like to thank you again. And if you do have any further questions, feel free to get in touch with our team. Our enrollment team will be more than happy to take any of your questions offline and cater to them individually. You'll find the details on the slides at the moment. But other than that, really, again, we hope you found this presentation very useful. Thank you once again. Have a lovely evening, and we'll hopefully see you in our next session soon. Take care.
Thank you, Azad.
Bye.
Bye-bye.
Bye, everyone. Nice to meet you.